Doctor, are you duly licensed to practice medicine and surgery in the state of New York? Yes, and I have been so licensed since 1963. Are you board certified, doctor? Yes, I am. Do you have an area of specialty? I do. And what is that? It is sports medicine. What is your medical specialty, doctor? Orthopedics. Do you have a subspecialty? I do. Which is what? As I said before, it is sports medicine, I would term it. Defendant's counsel. Your Honor, the defendant will concede the doctor's qualifications in his area of specialty. The court. Do you accept the concession by your opponent? Plaintiff's counsel. Yes, Your Honor. The court. So it is stipulated that the doctor is qualified as an orthopedist, and you don't have to proceed to interrogate him on that subject. Plaintiff's counsel. Yes, Your Honor. The court. Go ahead. Doctor, in the course of your professional practice, did you have an opportunity to see the plaintiff? Yes. When was the first time that you saw the plaintiff, if you recall? From my records, I saw him on January 8th, 2002. At that time, did you perform an exam, doctor? Yes, I did. What part of the body did you examine? I examined the right knee. Did the plaintiff convey to you the history of a work-related accident, doctor? Defendant's counsel. Objection. The court. Overruled. You may answer, doctor. Yes, he said that the present complaint started 4 days ago when he fell at work, sustaining an injury to the right knee, which became swollen right away. You say the present complaint, doctor. Did the plaintiff have any complaints at the time of your exam? Yes, he was complaining of right knee pain. And you conducted an exam, correct, doctor? Defendant's counsel. I object to the leading, Your Honor. The court. The objection is overruled. I will allow it on these non-essentials. Yes, I did. What were your findings? My findings were the right knee was swollen and tender, and the range of motion of the right knee was restricted in the terminal few degrees of flexion. Was there anything else, doctor, that you found? I found, among other things, that the X-ray exam was within normal limits. Did you continue to treat the plaintiff after that, doctor? Yes. Defendant's counsel. Counsel, do you think you could cut to the chase? Plaintiff's counsel. All right, Your Honor, but I would appreciate a little latitude. The court. Go ahead. I saw him 2 weeks later. At that particular time, did you make a request for any diagnostic testimony? Yes. I ordered an MRI of the right knee joint because at that time the complaints were mainly confined to the medial joint line, which is a very specific sign for a torn medial meniscus. Defendant's counsel. Move to strike as not responsive. The court. Objection sustained. Strike it out. Doctor, did you continue to treat the plaintiff subsequent to the January 22nd exam? Yes, I saw him on February 19th, 2002. At that particular time, did you have this benefit of any diagnostic tests? Defendant's counsel. I object to the form, Your Honor. The court. Objection overruled. Yes, I had an MRI of the right knee joint, which was taken on February 12, 2002, and it reveals that there was a tear of the medial meniscus. Did you discuss any treatment with the plaintiff during that period of time? Yes, I suggested to him to consider the right knee arthroscopic examination and meniscectomy. What was the response of the plaintiff to that, if you recall? We agreed. Defendant's counsel. Objection, Your Honor. What did he say? The court. Objection sustained. We requested, since this was a compensation case, permission to have the operation. At any time, did the plaintiff have the operation? Yes. When? April 24th. By whom? Myself. Doctor, when you performed the operation, what did you find? The findings were that it was a large medial plica, which is a fibrous tissue rubbing over the anterior medial aspect of the knee joint. Okay. Also, there was a big chondral defect. It was 1 by 1.5 inches in the medial femoral condyle at the weight-bearing area. Doctor, did you find any calcium deposits at that time? Defendant's counsel. Objection. Leading. The court. Overruled. At any rate, it is noted in the bill of particulars. Yes, also, there were several involving the posterior corner of the medial meniscus. Doctor, after you performed the surgery, did you continue to treat the plaintiff? Yes, I saw him on May 2nd, when I removed the sutures. Defendant's counsel, I object to the answer and move to strike it out. The court, I will allow it. You say that you removed the stitches. Do you know if he was working on May 22nd?